Hi everyone, it's Dr. Shepard, and what I'd like to talk to you today is about the serratus anterior activation exercise. I've had a lot of patients email me, or they ask questions the second time I go through it again, and just to kind of correct that and make it as simple, as clean as possible, I want to make a video that you can either follow along at home to do, or you can maybe watch a couple times to really kind of get the little nuances of this exercise. Now this exercise is extremely important for anyone that's had shoulder blade or scapula pain, and what it does is anytime you have shoulder instability, it's usually your serratus anterior muscles not activating soon enough in that motion, so you actually don't have a stable scapula. The scapula tends to kind of move, and you notice that you have altered motion. You just get that chronic over tight rhomboids and just area that's just constantly under bombardment and under pain, or just burning pain. So what this exercise is going to do is activate that, so it holds your shoulder blade more against the cage of your thoracics, so then basically allows your shoulder in all to be more stable, and the motion to come directly from the GH joint, your glenohumeral joint, instead of the scapula moving along. So to get into the exercise, make sure you have a band handy. If you don't have a band, what you can use is a towel, and you're going to either want to basically pull the band apart and just rotate like this, or with a towel, you're going to want to hold it for 30 seconds. So the difference is, if you have a band, I want to have you do 30 little short reps. If you have a towel or a shirt, I want to make sure you're just going to hold it just to maintain that activation of the muscle. So to get into the exercise itself, what I want to do is we're actually going to lay right on our backs, just like this. Make sure you're doing it on the floor. We don't want to have rounded. You want to make sure our neck is nice and tucked. And what we're going to do is just have our elbows right against our side. And what we're going to do is, you can start by just touching your thumbs, and then we're just going to rotate our arms out like this, so that our thumbs are then pointed towards our head. And we're going to hold it for a second or two. If we're doing a band, again, if we're doing with the towel, just hold it for as long as you can. The goal would be 30 seconds. And then we're just going to nice and relax. So it's usually about, we're going to hold it for about 1 to 2 count, and then we're going to slowly go 1 to 2 and go back down. Now, if you start to feel some of the tension maybe too much in the forearm, it will do a lot of forearm muscles, but what you'll feel is your shoulder blade again suck up to your cage. Now, if you just have a thick or a thin band, if you want to feel that little nuance, you can just maybe have 1 layer, but if you really want to get benefit, you can start about 2 layers. So that's the first level of the progression. If you have any questions, you can either leave comment below this video, or you can email me directly at drshepard@bnchiro.com, and I can talk a little bit about the second and third portions of that exercise. But right now, I just want everyone to start with the basic one, and that's just going to be on your back with your elbows nice and tight. Again, if you have any questions, leave a comment right below this video.